The topic under discussion today is going to be very interesting because of its names. What do I mean by names? Very simple. A single topic discussed in different books by different names. Antimycobacterial in one book, anti-TB, anti-tuberculosis, anti-tubercular. Simple. These all topics are actually discussing one very simple issue, that is TB. So in today's discussion, we'll talk about specifically the drugs that are going to treat the TB. Okay, so let's start our discussion. And before we start our discussion, I would love to tell you people the points that are the part of today's discussion. Point number one is mycobacteria. We'll talk about mycobacteria. We'll know about its structural composition and somehow the internal content. And then we'll talk about the pharmacology, means the drugs used to treat the TB patients. In this pharmacology, we'll be talking about the first generation, the second generation, anti-mycobacterial. And in the next point, we'll be talking about the terms like MDR and XMDR. We'll clear the concepts of these terms. Then we'll talk about the regime, intensive phase and continuous phase. So let's start our discussion from the very first point, mycobacteria. What is mycobacteria? That particular bacteria which is supposed to cause TB. Simple, okay? Now, why this particular bacteria is known as mycobacteria? Very simple. The answer is because this particular bacteria has got a cell wall in which there is mycolic acid. Because of this mycolic acid in this cell wall, this particular bacteria gets the name mycobacteria. Very simple. And remember one very important point, that this bacteria has some other moieties also along with mycolic acid, which are responsible to synthesize the cell wall. But mycolic acid plays a very important role. The reason behind is that we'll tell you the reasons in the explanation of the pharmacology. Now let's come towards the next points. As you guys know that a bacteria has a cell membrane, then cell wall, okay? We know all the concepts. Now just coming towards some very, very major points that are going to actually help us to understand the mechanisms of the pharmacology. You can say these medications. So coming to the next point, bacteria is having the DNA from which it is actually synthesizing the RNA. Then that RNA will come towards the ribosome, and at the end it will synthesize protein. You must remember this cascade, or you can say this path. So because of this, I told you it will be very easy for you to understand the pharmacology. Now let's come towards the pharmacology. Here we'll clear some more concepts regarding the mycobacteria. In the pharmacology, we have first generation and second generation, okay? According to first generation, we have isoniazid, rifampin, ethambutol, pyrazinamide, streptomycin. According to second generation, we have aminoglycoside, fluoroquinolone, macrolides, and baraquilene. Now, those who have knowledge, they might have got the concept that why Dr. UUT is discussing streptomycin in the first generation, though it is an aminoglycoside. Yes, you guys are right. It is aminoglycoside, and it is included in the first generation according to some textbooks. And some other aminoglycosides, they are not placed in the first generation. That's why we are placing all of them in the second generation. Then we have fluoroquinolones, macrolides, etc. Now let's come towards mechanism of action of each. Okay, the very first one is isoniazid. Isoniazid, it actually targets the mycolic acid synthesis, and you guys know that mycolic acid is synthesized by means of an enzyme, that is mycolic acid synthase. This isoniazid will actually inhibit that synthase enzyme, mycolic acid synthase enzyme. If that enzyme is inhibited, what will happen? Then the mycolic acid won't be synthesized. And remember, if mycolic acid is not synthesized, then this particular bacteria is no more able to sustain its life. Means then that bacteria will die. So these isoniazids, rifampin, ethambutol, pyrazinamide, streptomycin, and second generation, okay, in short, they are actually responsible to either inhibit the growth or to kill bacteria, okay, mycobacteria. So this is actually their functional role. Now let me tell you guys the only sites and their actions, okay. Now isoniazid is actually going to inhibit the mycolic acid synthase, which will inhibit the mycolic acid synthesis. If mycolic acid is not available, then the cell wall won't be synthesized. And rifampin, very important function, it is going to inhibit another enzyme that is now named as DNA dependent RNA polymerase. which is supposed to synthesize this RNA. So if we give rifampin, that will actually inhibit this enzyme. If this enzyme is inhibited, then no RNA. If no RNA, then there won't be the synthesis of the protein at the end. So we inhibited cellular synthesis, we inhibited protein synthesis. Then we have ethambutol, a very important medication. It is going to inhibit another enzyme that is named as amino acyl synthase. So if this enzyme is inhibited, first of all, let us know what is the function of this enzyme. Amino acyl synthase is supposed to synthesize aminogalactane, which is a responsible factor or component in the cellular synthesis. So if we give ethambutol, they will inhibit this enzyme, then they won't synthesize aminogalactone, which is actually the component of cell wall. So like this, we inhibited the cell wall synthesis. By means of isoamino acid, we inhibited cell wall synthesis. By means of rifampin, we inhibited protein synthesis at the end, okay? And by means of ethambutol, we are inhibiting the cell wall synthesis. Then we have pyrazinamide. It has got another very interesting function, that is, it is going to inhibit the fatty acid synthase enzyme. It is another enzyme which is responsible to synthesize fatty acid. So now, if we inhibit this enzyme, then fatty acid won't be synthesized. And another very important role, this has got actually two functions, two mechanism of actions. One is this one, another is it is going to inhibit the protein synthesis again. And we have the next one, that is streptomycin, which is actually aminoglycoside. Aminoglycosides, all aminoglycosides, approximately, they have got a single functional role. That is, they are actually inhibiting the protein synthesis. How? Like, very simple. They inhibit the assembly of large and small units, and they also inhibit the pairing of codon and anticodon. So you can say codon-anticodon pairing and assembly of large and small units of the ribosomes. That is actually, you can say, a kind blocked, inhibited by means of the aminoglycosides, streptomycin. Okay, these all have got same function, mechanism of action. So you can say, in short, they are also responsible to inhibit the protein synthesis. We have fluoroquinolone. Remember our last lectures regarding aminoglycosides, all we have explained all these mechanisms, but now here regarding this anti-TB, I am telling you people very short, okay? We have explanation of all. Fluoroquinolones, which are actually the modification of the quinolone. So now these fluoroquinolones are responsible to inhibit the DNA replication. Okay, here we have DNA gyrase enzyme or DNA gyrase, which is responsible to facilitate DNA replication. But this fluoroquinolone will come and it will inhibit the function of DNA gyrase or DNA gyrase. So you can say then there won't be DNA replication. Then the coiling of the DNA will remain the same. Supercoiling will be seen. So when there is supercoiling, then there is no any DNA replication. So you can say, in short, it is actually inhibiting DNA replication. And we have macrolides. Again, they are supposed to inhibit the protein synthesis. How? Like, they won't allow the translocation of the transfer RNA or the peptides. Means here the peptide is supposed to be synthesized like this. You guys might remember in the protein synthesis we have discussed this point. So you can say the macrolides are also responsible to inhibit the protein synthesis, in short. Okay, we have discussed the mechanisms in detail. Then we have beta-quilene. And this one has got another interesting mechanism, that is, it is actually inhibiting another enzyme that is named as ATP synthase. You guys know that ATP synthase is responsible to synthesize ATP. So it synthesizes ATP by means of using the ADP. So it is synthesizing the ATP by means of converting ADP into ATP by means of an enzyme that is ATP synthase. So beta-quilene will actually inhibit that ATP synthase enzyme. So then there won't be any ATP available. So like this, we inhibited ATP synthesis, protein synthesis, DNA replication, RNA synthesis, cell wall synthesis, and fatty acid synthesis. So these are all the medication that are responsible to inhibit all these particular points. So like this, if we are inhibiting these particular portions, so by means of these methods, we are actually inhibiting the growth, or we are actually leading towards the death of that particular bacteria. Means these particular medications will cause the death of these bacteria. You can say, in short, these medications are supposed to show either bacteriostatic or bactericidal mechanism of action on this particular mycobacteria. That's it. Now let's come towards the terms MDR and XMDR. MDR stands for multiple drug resistance and XMDR stands for extensive multiple drug resistance. Now multiple drug resistance is actually when a patient is having resistance, or the person is showing resistance, that patient, against isoniazid and rifampin, these two, then that particular patient is actually the multiple drug resistant patient, and that person is actually named as MDR patient, and the person is having the TB, that is MDR TB, multiple drug resistance TB, which is actually the resistance of that particular bacteria against isoniazid and rifampin. And we have extensive multiple drug resistance. In this, the particular patient has got the bacteria that are actually showing the resistance against isoniazid, rifampin, ethambutol, and another one. So you can say more than two, either 3 or 4. If a patient is showing resistance, you can see if those bacteria of that patient is showing resistance, then that TB is actually named as XMDR TB, extensive multiple drug resistance TB, and MDR stands for multiple drug resistance TB. Here we have two medication against which that particular bacteria is resistant, and in this TB the bacteria shows a resistance against more than 2, either 3 or 4 drugs against which the bacteria is showing the resistance. So then that TB will be named as XMDR. Now let's come towards the regime. Very simple. We have two phases actually in the antimicrobial treatment therapy. One is intensive phase, and the other one is continuous phase. In the intensive phase, it is a kind of phase in which the patient is responsible to take a bunch of medicines like isoniazid, rifampin, ethambutol, and streptomycin somehow. So actually the patient is going to use 3 to 4 medication for about 2 months, okay, for about 2 months. In continuous phase, then the same patient is responsible to take the medication for about 4 months. So like this anti-TB therapy will be actually of 6 months. And remember, this therapy may exceed from 6 months to 8, 12, and up to 2 years. Means according to MDR, this may take 2 years. So you can say therapy may exceed from 6 months to years. So it is depending upon the patient. That's how the patient is responding to the drugs and how the patient is showing the compliance against particular therapy. So that's it from my side. If still you have a confusion, drop in the comment box.